started with the same volume, so the end systolic volume is the same. Go through ventricular filling here. Right off the bat, you got to notice right here, increase in end diastolic volume. That also corresponds to an increase in preload. And then if we go up isovolumetric contraction here, if you'll notice, there's not much of an increase here at all in the increase in pressure at the point of where the aortic valve opens. So I would say the afterload is the same. And then as you go through here, through systolic ejection or ventricular ejection, as you can see, this is about the same. So there's no change in contractility. And so again, you've gone to this point. Now what's important as you get over here to the end systolic volume, again, which we said is the same, what's important to note here is that as a result of the end diastolic volume being increased and the preload being increased, you had an increase in the stroke volume. And so you had an increase in the amount of volume of blood that was ejected during systole. And that follows the Frank-Starling relationship. Increase in end diastolic volume corresponds to an increase in stroke volume. Afterload's the same, contractility is the same. So this really just corresponds to an increase in preload. This is what this PV loop corresponds to. Again, that corresponds to increased venous return. And there's a number of things that can cause that. Clinically, one example would be is if you gave IV fluids. So if you give them an IV bolus of fluids, one benefit of that is it can increase their preload and increase their stroke volume as a result of that.